The reason why it's so important that organisations listen is that actually if we're going to truly put our staff and our patients at the centre of what it is that we're trying to do, we have to know what they think, we have to know what they believe, we have to know what they want. And how can we do that unless we listen? The problem with listening is that it has to be active. We can't just passively listen. We have to hear what people are saying, and then we have to translate what we're hearing into action that will actually improve the way that we work. There are many ways in which we can listen, and we need to do it at all levels if it's going to be meaningful. We have to help people at that care interface to make time, to legitimise that time to sit with patients and listen to what they have to say. We have to take the feedback that people give us, whether that's from complaints or compliments, and turn that into something that's positive so that we can learn and that we can improve. But we also have to work at that level as a board. If when we're sitting around the board table ultimately making decisions about strategy, making decisions about performance, making decisions about everything we do as an organisation, we have to translate that bottom-up listening into action that actually really sits at the centre of improving patient care. One of the things that has come through from some of the learning that we've done within Cwm Taf is to actually focus on the need to connect people back to caring. It sounds very basic, but this is about the connection between what you know and understand and what you feel. Because often what people tell us is that the technical aspects of care are very good, but the compassion with which it's delivered is sometimes missing. So in going back to basics, what we're actually trying to do is to get people through their learning to really connect with that compassionate element of care. And if we're not careful, the harder we're trying to work in difficult circumstances, the less we listen. Because listening takes time, listening takes effort. But actually, if we do stop and listen, particularly in times of extreme pressure, we're likely to get things right first time and not be spending a lot of our time, effort and money in putting things right after the event.